Hey, all my pink supporters and fellow pink warriors. And this is Tammy Frazier coming at you with day 12 post-op report. I actually took a little bit of time. Thought about putting out a day 10. Seemed like a good time to put one out, but I had a follow-up appointment with my breast surgeon's office. Unfortunately, my breast surgeon was out of town. I did know about that ahead of time. Was very disappointed when they scheduled the appointment, knowing that she was going to be out of town that day. So I saw her physician's assistant, her PA, on Friday. So I ended up taking a little bit of time to process and research and process some more. This multi-page pathology report from my double mastectomy. So just to recap, originally I was diagnosed with invasive ductal carcinoma in my right breast. No breast cancer diagnosis specifically in my left. There were some areas of concern. One of them was biopsied prior to surgery and was benign. The other one was biopsied after surgery and was also benign. So that's good news. But according to let's talk about all good news first. But let's just put it this way. They got it all. And all of my margins are negative for ductal carcinoma. So that means that they got all the cancer when they did the surgery. And my chest wall was not affected, which is super, because I thought that I was going to, when I said that I think that I'm going to need radiation, you know, I told you guys my spidey cancer senses were at work, and I felt like I was going to need radiation. I was thinking because of the margin and how close the tumor was to the chest wall and whether it had maybe invaded the chest wall. So it turns out that it did not, which is super. However, when they did the sentinel lymph node biopsy, they biopsied one lymph node from each side. They did find some isolated tumor cells in both sides, despite the fact that I don't have any malignancy in my left side. So that is rare for that to happen. It has a fancy name. Synchronous contralateral axillary metastasis. So synchronous occurring in both, contralateral occurring even on the side that is not the cancerous side, axillary lymph node, metastasis. We all know that that means that cancer has spread. So while this is absolutely not the news that I expected, it does make a little bit of sense because this particular, the way that it occurs in the lymph nodes and just having some isolated tumor cells in the sentinel lymph nodes would not show up on any of the prior screenings, which is why I had been told that my lymph nodes were looking good. They were looking like they were going to be clear, but this would not show up in any of the screenings. On the left side, it's just some tumor cells. On the right side, there are two aggregates. The largest was 0.05 millimeters, and the greatest dimension that was found on the right. So that's very small, and they are, according to the pathology, not thinking that it is spread to any other parts of my body, probably not even to any of the other lymph nodes, but this is why we're still thinking that I'm probably going to be going through radiation. So even though it wasn't invading the chest wall, that it has even slightly affected the lymph nodes. But this controversial classification of this contralateral axillary metastasis, it's controversial as to how to classify it, whether it should be classified as a loco-regional or a distant metastasis. Yeah, they just are not really sure how to classify that and which one of those is the most appropriate. So for purposes of my pathology, they have classified it as loco-regional, which is isolated in one area. But they did want to make sure that it is understood that if it were classified as distant metastasis, that it would be basically a stage 0, meaning that it has not spread outside of its original origin. So that's kind of where things are at. If you're ever in a situation where you're supposed to be getting pathology results, never. Just take an appointment with the PA, because I left that day feeling very, there was a lot more information in this pathology report than the PA went over with me. You know, she didn't know my case, and my breast surgeon knows my case very well. My breast surgeon is the one who, the doctor who reviewed the pathology, went over everything with her, not with the PA. So I just didn't feel like she was prepared to thoroughly explain what is in this pathology report to me. So I spent a lot of time researching it myself. And I will speak with my breast surgeon when she's back in the office. I'll call first thing in the morning tomorrow and try to see if I can get on the phone with her, for her to go over everything with me to make sure that what I think my understanding of it is actually accurate. So yeah, it wasn't the absolute news that I was hoping for. Like I said, I thought that I was going to need radiology, but it was for a different reason. So, but if it had to be for lymph node involvement, at least it's very, very little and very, very, very early, very low staging in the lymph nodes. So that's where we are. And I will update you guys when I have spoken with my breast surgeon to find out if everything that I am interpreting in my pathology report is accurate. Thanks for watching, thanks for caring, and I'll see you next time.